Okay, good evening, everyone. Gareth Presh, founder of the World Health Innovation Summit, and delighted to be streaming live this evening as we discuss COVID-19. I'm joined by a host of experts around the world, and we're going to let everyone introduce themselves very shortly. We're just going to talk about COVID this evening and what are the lessons learned up to this point. Just to put some context into our discussion this evening, we've had over 12 million infections worldwide and over 500,000 deaths. And we're seeing that increase, and we expect that to grow over the next couple of weeks and months. I'm going to start this evening by introducing Dr. Amir Hannan, who's a GP from the NHS in Manchester, who's also the chair of the World Health Innovation Summit. And Amir, would you kindly be able to just do a short introduction, and we'll get this discussion going. And also, those who are joining us this evening, if you have a question for the panel, please do pop it into the chat line. And also, if you could tell us also where you're from when you join the discussion. So, Dr. Amir Hannan, we're delighted to welcome you to the discussion.
Thank you, Gareth, and thanks very much for inviting me to come and speak today. So as you say, I'm a full-time general practitioner in Manchester in the UK, and I'm also chairman of the World Health Innovation Summit. COVID-19 first presented itself to the WHO back at the end of December 2019. And since then, as you say, we've had a huge increase in the number of cases throughout the world. In the UK itself, we've had 289,603 cases as of today, and 44,819 deaths. The numbers are now starting to reduce in terms of how many people are being diagnosed with it. So we've got 650 cases as of yesterday and 21 deaths. So there are still deaths happening, but a lot less than the heady heights that we had, say, a month, 6 weeks ago. As a consequence of that, and just to give you some idea of what things are like in the UK at the moment, I went to have my hair cut done, one of the things that we can now do as of this week. And it was an interesting experience. I had to book the appointment beforehand instead of just turning up. When I turned up, I had to wash my hands. There were no magazines to look at. Each of the bays were separated by a screen. The hairdresser that I had was wearing not a face mask, but a face shield, if you like. He talked about, so got a haircut done. What he talked about was the fact that he'd not been to see a doctor for many years, but whilst he'd been off for the last 3 months, he booked an appointment with the doctor. Instead of seeing them, he was able to do it over the telephone, and he found that to be really easy, and he was surprised that he could see a doctor the same day or speak to a doctor the same day as opposed to having to wait weeks. And having realized that, he then went on to book 3 appointments in that same week. That's lots of changes that have happened in the UK, but lots of potential problems with that as well, which I'm sure we'll be able to talk about later. So I look forward to the discussion. Thank you.
Thanks very much, Amir. Isabelle from WHO in Geneva.
Yes, thank you so much, Gareth, for the introduction now. For me, you know, it was important to, in terms of introduction, to mention, you know, COVID-19, you know, this crisis have highlighted, you know, a big issue in terms of leadership. Specifically, you know, we have seen some crisis in terms of how you convene, you know, all the stakeholders, you know, together, and specifically around the universal value focus. What we have seen as well, it is, the lack of, for me, holistic approach, you know, specifically this health system perspective was not systematically taken. And I think this type of crisis invite us to rethink our way, you know, of living, but as well to transform our vision, specifically related, you know, to how we are living and how we balance our life. For example, with our ecosystem. So that it is just the introduction for me concerning this crisis, and I hope we will have the opportunity to go in details.
Thanks very much, Isabelle. I can appreciate the difficulty, trying to work across all these different sectors and get the communication, right, shall we say. Very difficult job. Luis from Mexico, delighted that you can join us. Could you give us a bit of a background and some, we can get into an insight from Mexico as well. We're really looking forward to learning from Mexico.
No, of course. Thank you, Gareth. It's my pleasure to be here with all of you. The situation in Mexico, it's totally different than what is happening actually in the United States and Europe or other regions where I'm seeing that you are. For example, from figures from the London School of Hygiene and Tropical Medicine and the Johns Hopkins University, the World Health Organization, up to last Friday, Mexico reported 282,000 cases. And if I'm not mistaken, 33,526 deaths. The problem here is that the current fatality rate for Mexico is 11.9, which I understand that is one of the highest rates at the moment in the world, perhaps in the top 10. And the current projection, and this is really alarming for me, the current projection from the Institute for Health Metrics and Evaluation from the University of Washington, they mentioned that Mexico will have 100,000 deaths in November of this year if all the situation continues this way. So that's the background of what is happening here in general figure, with general figures. But I also would like to say that we identify some problems, and I understand that we don't have much time for these webinars. So I may say that Mexico is not actively testing. So at this moment, there is no clear picture of what is happening in the country. Mexico is not tracing positive cases. We have to remember that 48% of transmission comes from pre-symptomatic people. So this is really, really important, and perhaps is one of the topics that we can discuss today. So Mexico needs to treat all symptomatic and asymptomatic cases, and isolation and surveillance are essential for pre-symptomatic and asymptomatic cases. So without a solid strategy for tracing these cases and treating asymptomatic and pre-symptomatic cases, the figures of cases and deaths will continue high as are in this moment. And this is a principle that applies for every country, and perhaps is one of the main strategies and policies that each country with now in the pandemic should take, Also, a different problem that we are seeing is that the healthcare system is partially disrupted. I'm talking about routine healthcare. So patients with non-communicable diseases like diabetes, like hypertension, are not attending in the primary health centers at the moment because the focus is on the pandemic. And we have to remember, perhaps in this webinar, that diabetes, hypertension, obesity relates with the severity and the mortality of the disease by COVID-19. So the problem for Mexico is that Mexico has one of the highest prevalence for diabetes and obesity. So if you are focusing on the pandemic and knowing the chronic conditions, you will have more patients with these chronic diseases without any metabolic control, and then you will have more cases and more severe cases and perhaps more deaths in the future. So we have to see this problem as a complete health problem, and not just focusing on COVID-19. Perhaps is one of the lessons that I can share with you from Mexico right now.
Yeah, I think it's a brilliant lesson. We'll touch on that because I think NCDs, we 50 million deaths per annum, over 50 million deaths per annum. So we need to put things into context as well. We know there's been serious disruptions to surgery, for example, over the last 12 weeks. 28 million elective surgeries have been delayed. I'd like to go to Professor Haq from, you're stuck in Bangladesh at the moment, but based in Malaysia. And I think we can learn a lot of lessons from Asia, for example, the great work that Taiwan, Singapore has done. And then it would be really great to get an insight from yourself.
Oh, thank you very much, Gareth. Yeah, thank you very much. And my background already, I told that I'm a cardiologist and also a public health expert. And so now currently I'm in the lockdown in Bangladesh. So when the COVID started, that time I was in Malaysia, and then after that I was in India. So the current situations of the Asian countries, I can say that is really, I think it's a good thing that the cases are now decreasing in Asian countries. So what I can see that in Bangladesh, the active cases like is 177,000 and more than that, and the death rate is like 2,200 only. So according to the number, I think it's not an increasing number for that. And for the consciousness, people are very conscious now because everybody is aware of the social distancing, the wearing of the mask, and social gathering. So it is prohibited now. So in the Malaysian perspective, what we have taken the procedure like MCO, movement control order, during the COVID situation there, and the active cases was only 8,000 something there in Malaysia, and the casualties are very less in Malaysia. And in Southeast Asian countries, like the more cases were in Indonesia, and there is a good measurements in Taiwan. Already you mentioned the name Taiwan, Hong Kong, Singapore, and also Thailand. They have taken good measures, and the COVID is I think is not spreading too much now. And the good success results from the Vietnam, they are achieving their highest goal. There is no death cases there. So it is a very good opportunity for us to work with the Asian countries, and especially according to WHO now, there is a warning sign that this virus can be spreaded by the airborne. So people are more conscious now, and they are more panicked with these things because before it was not known that it is spreading by the airborne. So now everybody is very conscious about that, and people are more, more panicked about this. So I should say we should not be panicked with this situation because it's a pandemic situation, and we need to fight with this COVID, and we need to, cope ourselves with to, I think, to go ahead with this COVID situations. So this is the perspective from the Asian side. Thank you, Gareth.
Thanks, Professor Aki. Dr. Mwambe, who is on the front line as we speak, is in the Cumbrian Hospital at the moment. Perhaps you could give us some context from your perspective locally here, but very much like to understand as well, just from the introduction point of view, the African situation, because COVID is now beginning to, shall we say, develop across the continent, and I'd like to, we can touch on that further along the discussion. But if you could just do an introduction, it would be fantastic.
Okay, thank you, Gareth. All right, for me, for the African continent, it's really a mixed bag because, as we all know, the data from the continent is a bit very patchy, either for capacity reason or for political reasons. So what we have so far from the Africa CDC, there are about 577 cases with 130,000 deaths and a recovery of about 290,000. But again, like I said, the data is not very consistent because some countries seem to have more cases because they seem to be doing more testing, and some countries they don't test at all, and the openness is a bit of a problem because there's a bit of a mistrust of the system. But from speaking people on the ground in the country, like from Tanzania, for example, the cases are going down quite a lot, and the life is going on as normal because different countries, they took a different approach with COVID. Some people chose to do lockdown, they do some testing. Some countries decided to do the simple things that they can afford to do well, knowing that it's difficult to institute like a lockdown because some people have to go to work to get their food and stuff. So, for example, give an example. Because I'm from Tanzania, I'm going to give an example of Tanzania. Tanzania, they did not put on a lockdown system. But what they did, that a lot of education, the public education for people to do the simple thing like hand washing. And if you could go to work, you can go to work, but that didn't work because people went to work anyway. And then they've been advised to use simple things just to either believe some traditional stuff. That's what they use. They've been encouraged to use some traditional medicine which boosts the immunity. And the people seem to be, I mean, these have taken the fear out of it, because at the beginning people were so scared because they put COVID in the same category as the Ebola kind of thing. So it was a very big fear. So when they realized it's not as bad as Ebola, so people kind of took the fear off and just did the simple, safe things well. And I think the situation now, people, you can fly to Tanzania, but as long as you do the simple thing, that's fine. We see we don't have data from many countries in Africa because they don't do testing. But as far as I'm concerned, they seem to be, the cases are going down. But I think there's a possibility that people may become a bit lax and the things may end up being exploding. I mean, that's what worries me a little bit, because I think things may turn out to be worse than it is now. Mm-hmm. Because, yeah, like now, personal here where I am, like Dr. Amir said, like today, the whole day I've been here since 12 o'clock, I have seen probably 3, 4 possibly COVID patients. So it's not that good. We don't have many patients around here. So we're getting somewhere better.
That's very encouraging. Paul, from the US perspective, really great to get an insight from yourself. You know, you have your thoughts, and you're really welcome.
Yeah, hello everybody. It's great to talk with you today. So the U.S. has been struggling because of conflicted leadership and lack of centralized guidance, that coupled with lack of true transparency and trust gaps is undermining the ability to work in the same direction. And I want to focus on that. There are many important issues to talk about today. Isabelle talked about leadership, and it's clear to me that the countries that are doing the best are using 4 principles. Number 1, they're telling the truth. Even when they don't know the problems, they're saying, I don't know. Number 2, they're being very transparent about releasing the data and doing it early and as often as possible. Number 3, they're focusing a lot on building social trust. And social trust is not by telling people I'm telling you the truth. Social trust is by supporting their needs. So, for example, one of the reasons why Taiwan did so well is that early on in January, before they had any cases, based on their experience with SARS, they decided to build an app where you could find out where to buy toilet paper, where to get flour, where to buy eggs. There was no panic shopping in Taiwan. So 28 million people knew exactly where they could find toilet paper. I still can't find wipes in the US, which is remarkable. It is impossible to find wipes that are true anti-SARS-2. And so what's really interesting about this is that, again, by building social capital, social trust in leadership in countries like New Zealand, like Norway, like Taiwan, they were able to do the harder things when it required lockdowns or distancing and masks. So trust, truth-telling, transparency, that leads to the next thing, which is co-production and team building. And so it's clear that this disease cannot be eradicated by government. It requires a huge impetus by the people to take on responsibility. That might mean not going out. It might mean not socializing. It might mean wearing masks. It might mean washing hands. And there's a whole series of things that are, I think, mistakenly called liberties, but in fact, they're really rights. And your rights as a citizen is not to flamboyantly hold that flag up, but to be accountable to the community around you. So the communitarian spirit means that governments that have talked about the role of the people to engage and to lean in, to be part of the solution, have been able to build a lot of social trust. And you can see that they've been able to get higher rates of mask wearing, higher rates of people willing to self-contain, self-quarantine, versus other countries like my own, in which you've had massive protests not only because of racism, which is a serious issue, but more importantly, because of a breach in social trust. And so fundamentally, dealing with all pandemics is about building trust. It's not about more testing, although testing is important. It's not about quarantining, although quarantining is very important. It's about communitarian values of trust. And the only way we can move forward is to talk more about how do we build, engage, and support trust. And that means supporting the weakest in our communities. That means universal healthcare coverage. That means being very honest about the unknowns. We don't really know what's going to happen when you open up wide schools. And the public knows that they're not being sold a true bill of rights. They know that people aren't telling them the whole story. And so I think countries and leaders that have been the more willing to be truthful about the limitations of the knowledge, as well as the sacrifices, have been able to get a longer runway so that they're able to build the herd immunity, they're able to build better social support systems, and they're better able to justify their policies on ethical, sound, and universal health rights approaches. That's where I think the best countries are moving. So I hope we can have a conversation about the role and importance of those aspects.
Absolutely. I mean, myself and Isabelle, we touched on this briefly before we came online, just about the social capital element and the trust being open and transparent within communities. Manuela, from your perspective, thanks very much for joining us, and I appreciate it's very, very early in the morning in Australia. Could you give us a bit of a context from your perspective in Australia? And also, we're delighted to welcome you.
Thank you. Very nice to be here. Hi, everyone. In Australia, the first cases of COVID-19, I think it was at the beginning of February. Now, just to give you some ideas, so the total population in Australia is 25, or almost 26 million, divided in 7 states and 2 territories. The total case up to yesterday of COVID-19 were 9,726. Active cases are 1,526, and the total death all around Australia is 108. In a state where I live, in Queensland, there's no cases being reported now for a few days. There have been over 3 million tests carried out, but simply in Australia, the system works a lot in self-reporting. So Australians have been slowly emerging from the COVID-19 lockdowns since the federal government announced a 3-stage plan in May to ease restrictions across the country. But from midnight on the 8th of July, the Melbourne metropolitan area and Mitchell Shire, that's an area immediately to the north, returned to a stage 3 lockdown for 6 weeks. So there's been going backwards in a sense in regards to Melbourne. The issue is, well, the finger anyway is pointing to people returning from overseas, so transmission from those who were carrying the virus coming from overseas. So Australia's been quite fast in closing not only the borders, but also imposing hefty fines for those who may want to travel and not being healthy or not being tested. So it's really very strictly applied. And everybody, basically, bottom line, must deal with restrictions on freedom of movement. And I agree with what Isabelle and Paul and others have referred to is about true leadership at this point of time. But true leadership is also about understanding people. So in Australia, there is a debate between good measures, but also excessive measures. This is, again, we can discuss it a little later, but certainly there is a need for transformational leaders with a vision that can really guide change through inspirations and motivation. But anyway, we'll discuss this a bit later. Thank you.
Yeah, thanks for that, Manuela. I think we've touched on the leadership perspective. I'd really like to know from everyone's perspective, if we could just go along the line, and we might actually talk to Isabelle first. who you think has demonstrated, shall we say, clear lines of leadership in this crisis, shall we say, who's taken the bull by the horns, so that we can learn the lessons going forward, because some countries, as Luis has mentioned, are, shall we say, just beginning to see a spike, and also within Africa we can potentially see a spike. So Isabelle, from your perspective with the WHO, who do you think has shown real leadership across the board? Also, just I don't know if someone can hear some typing, but if you are just if we could just mute the typing for the moment, please. Isabelle, from your perspective, could you give some examples of good practice that you could share with us?
Sure. First, I will start on the fact you have seen over the world. I will give a world view. What we have seen, and it was unfortunate, it is this lack of guidance, lack of global harmony or world harmony, in terms of the guidance. And specifically what we have seen, it is a series of contradiction, and politically, I will say, but as well scientifically. As you have seen, it was a lot of different fight, from different school of thought, I will say. And that it was really pity, because it was not to demonstrate, what have been built for many years, for example, to convene a multidisciplinary approach, respect for the different discipline, for the different fact, how you create effective linkage between the fact, and not to take immediately a strict position, and specifically what have been the big damage, I think, related to the fear, because the problem, it was the people are now in big fear, I can see around of me, and they are confused because you have not, consensus, I will say global consensus on any aspect of this crisis. Look, it is as well difficult for people because, we know behind the scene you have a mix of different interests. Can be, more social interest or more economic interest, and sometimes they are not compatible, we know that so well, and that have big influence, some direct or indirect influence on politically. What it is sad again, it is a fact it was not really focused, on and it was very well mentioned about the case of Taiwan, for example. What are the people needs? What are the needs? How we maintain already what we have built? We have advocate, for example, from WHO about health for all. We have advocate about how we maintain our well-being. Why? Because we want to maintain people with very high immune system. And when we see, in fact, the COVID-19 crisis impact, what we have seen, it was specifically, and we have more and more fact, more proof of that, it was very focused on people with deficient immune system due to the lack of balance of their life, can be as well dysfunctional nutrition, can be an issue of mental health. And we have seen how finally this issue of environment, finally, the social determinants of health, and specifically have led to more chronic disease, with more, diabetes, with more comorbidity, in fact, for many people in this world, have affected directly these people. And we have direct, for me, a correlation, and I think it's not good strategy to maintain people in fear, and again agree with the trust. It's about the trust. It's about caring for each other, and it is about respecting you know, as well, different perspective of the people, what they need, how they feel, and to take in consideration, you know, all this aspect, all this human aspect. And that helped tremendously in this process, because when you take time, in fact, to have a consensus, to have narrative, you know, is based on human perspective, you have, of course, less violence, less protest, you know, you have more harmony to lead and to go more together in this resilient pathway. Donc for me, it's very important to use this crisis to rethink our relationship with our environment and as well with ourselves, you know, and as well to question what type of relationship between the different countries, between the different people we want to build in the world to maintain, in fact, our human capital, our, you know, immune system, our the value of our life, you know. So it is very important to very focus on this key question. And sometime, and you have seen in the mainstream media, it was the worst for me, because the mainstream media, it was like no coordination in that, you know. Donc it was so confusing. One day you have one information, another day you have totally a contradiction information, you know. How people can continue to have trust or to be well, you know, if you don't know where you go, you know, what it is true, what it is not true, what I need to do, you know. And it was to have to secure yourself. It was a lot of effort for the people, you know, to have access to different information, you know, and to follow this narrative, because it was very complex narrative and not very accessible for I think many people in the at worldwide level. But that it is my my perspective with different discussion around of me.
I think there's a lot of opportunity there in terms of engagement within the community. Paul mentioned it about how do we bridge the gap, build the trust within the community. We have powerful platforms and tools like Facebook. Professor Hack, could you give us an insight from the Asian perspective, briefly around how you've managed it so well? And then we go to Luis and get a bit of an understanding how that could be transferred potentially to Mexico.
Okay, from my perspective of view, that what we have done in Asia, like I gave the example, like Hong Kong and other countries, and Taiwan. Also, you already mentioned about these things. So actually, it's all about the innovative idea now. So now we are trying to do some projects with the innovative ideas with the hardware and software things. So like if you know the Google tracing and Apple tracing, so the Hong Kong has already established one of the software there. So they put these devices like a QR code or smartphone technologies. So they put these devices in the school, college, universities, shopping complexes, and other places. So they can detect the COVID positive cases or infective cases, or you are free from the COVID. So that is the innovative idea. So they established in Singapore, Hong Kong, Taiwan, and other countries also. And now they are giving the training to the school, college students and other students also, and the general populations, that it is very important to maintain the social distancing, wearing the mask, using the hand sanitizer. So this is very important, So now you should be very careful when you are traveling with the public transport, or if you're going to any places, so be careful, like any restaurant or just okay. And if you go to the restaurant, so you must maintain the social distancing, like 2 meter, and the food habits. So there is a good examples in Asian countries. They are taking this opportunity, but some countries like like a high populations like India, like Bangladesh. So the population size is very high. So it is a little bit difficult for the government to control all the things. So in my views, that actually we must be careful of the frontliner, like doctors, the journalists, and healthcare professionals. So we must be careful, and we need to take take the lead to give the training to the people who doesn't know about these situations. That is very dangerous thing. So we should be careful about that, and we can train them more. I think more training needed, because most people still they doesn't understand that actually what is going on in the pandemic situations. So I think in these situations we can take a few of the measures like that, and maybe we can think for the new technologies and new medications and the new therapies we can apply for that. So a few of the countries like Malaysia, they are very successful to protest this COVID-19 due to the social distancing and the health regulatory authorities' decision. So they are very careful about that. So because this is a less populated country like Singapore, Malaysia, so I think it is a great example we can follow with this thing. And even China, they also take the innovative measurements like face detections, their thermometer, face scanning, thermal temperature, so everything. So I think it is a good example we can control this COVID-19.
Yeah. I think it's very encouraging that we learn the lessons, from Asia and from other countries. Luis, does this give you some hope? I also just wanted to say thanks to Terry and Jill and Les and Fanny and Sherry who joined us from Athens, Manila, Cumbria. So you can see we have a global audience who are tuned in this evening. So thank you very much for your time, for taking the time to join us. Luis, do you feel that there's opportunities to learn from Mexico's perspective to take the bull by the horns? And then Dr. Mwanda will come to you from the African perspective. Do you think that these, shall we say, engagement with mainstream media, or perhaps the medical professions and scientists could take the lead and do some more streaming, some online streaming, as we're doing this evening, could play an important role?
Yes, thank you, Gareth, and thank you all. Well, I have to meditate in something that applies perhaps for Mexico and the different regions of Mexico. Mexico, it's a really big country. I believe that we need first to understand that COVID-19 is not just a political crisis, it's a social crisis. And if we understand this perspective, we can concrete new approaches and new strategies to fight this pandemic. We need to remember that the success of our global response to this pandemic will rely on the responses of the weakest health and social systems in a country and globally. And we are talking about leadership, so I think it's important that local leaders, regional leaders, and the global leaders should promote more attention to those populations living in different situations, such as situations that expose vulnerability, like poverty, like migration, for example, which is a big problem from the Central America, Mexico, and the United States, and it's not the only region, but here for us is an important factor that we also need to consider. So from the general perspective, I should meditate that I really believe, and I'm convinced that we need to understand that COVID-19 is not a public health crisis, and that would be my lessons for the experience that we have seen in the world. It's a social crisis. As a social crisis, it requires a different, perhaps, approach. And in the particular perspective, and speaking about Mexico, and perhaps this concur with other strategies that we are listening right now, we need to use the treatise model from the World Health Organization: test, trace, treat. Test all cases that you can approach in your community, trace and identify suspicious cases, the symptomatic and the asymptomatic. Treat all symptomatic and asymptomatic cases because isolation and surveillance is really important to stop the spread of the disease. Really, really important. I also believe that it's quite simple to prevent these contagions, and we have to use face masks. We have to wash our hands. We have to maintain healthy distance. That's it. That's perhaps the main strategy that we can take from the perspective of the society. And most important, we need to actively build trust and communicate all the lessons that we are learning and share it with health professionals and also with general population. Another thing that I also that we are seeing here in the world and Mexico is like we have to take care of also mental health in our communities and engage the community in the social response. But most important, perhaps, the lesson that we have from the Mexican Society of Public Health is that we have to be aware and avoid the unjust disparities that COVID-19 is exposing and causing. So we have to prepare economic strategies and incentives to support the economy and those people that doesn't have a job, of living poverty, and doesn't have the resources to respond to the pandemic as we know they should do, because we know that not all populations can see the news, can have access to face masks, perhaps can have access to the primary health system. So I mean, there are a lot of problems that many regions can afford, but well, that would be my lessons from Mexico.
Thanks very much, Luis. I think you're absolutely right. It is a social problem as well. And I think also there's an important factor here that we can try and bring into this conversation, which is around the financing side of things. We need to bridge into the financial sector. The guys who hold the purse strings, they currently are looking for social investments and they're looking to create new jobs. And this brings opportunity around how do we, face the climate crisis that's coming around the corner. Right. Dr. Mwande, from your perspective, learnings here for Africa, is there hope from Asia and from the lessons that were, this discussion here? How do we transfer that to the masses across Africa? We need to get that communication out there as quickly and as far and as wide as possible. Perhaps the faith communities can help as well, and we can touch on that.
Yeah, thank you. And I think the key word here is the communication. I think communication is something which should be timely and reliable information to the public. I think that is where the main fight is, because if the public don't get it, then this COVID will stay here longer than it should be. I think everything how to be along the cooperation, coordination, and have a good collaboration with a good communication. They call learning. We need learning from one another. And the problem for Africa, I think there are a lot of things that are brought in without understanding the mindset of the African people, because it is a very different environment. So I think before we try to be understood, we need to understand first before we get it. I think understanding the culture and norms of your partner is very, very important, because otherwise the problem people say whatever solution be brought in play, it is something from, let's say, the West, and the people that don't engage very well. And Africa does not get invited to much to the table to make those big decisions. So they just and I think Africa have a lot of stuff to offer in the fight if you're given the opportunity, because we don't have much. The finance point of view is a bit patchy. We don't have much money. But I think we have a lot of brain, which if that gets supported, I think we can get a lot of innovation and a good thing coming out of Africa. And those things, stuff coming from Africa, they don't cost, probably won't cost much, which can be affordable. We're talking about digital technology. Okay, that's okay for the West, but for most people in a remote part of Africa, you cannot. You cannot reach them with digital technology. You have to come with a different sort of solutions. Like as TUHEDA, I'm the chairman of TUHEDA, Tanzania UK Healthcare Diaspora Association. What we try to do some webinars, but every time we do them, and we get people in the cities, but people from remote areas who need the information about COVID, they don't get the chance to attend those webinars. So even when you record them and put them on YouTube and send them to their phones, still the bandwidth or the connection is not great. Now, we need to find a different way, whether if you go, let's say, using television, for example, or radio. Radio is the easier one. And I think, but most people nowadays, they're more visual. So probably not many people will sit there and listen to the radio. So everyone's glued in front of the television. So if we can get the digital technology to, to reach far more, but this need investment because, for example, we don't have electricity in my village, and now you have to do solar power or some generators. So, but this, not everyone can afford this. Now the governments have to find a way of getting, let's say, get electricity to the places, so you can bring in the technology, the digital age to remote areas, so that people can get the information, because the information is power. If people knows what is what, they get that information. I think people are sensible enough to engage and make a difference, because no one want to get ill, no one want to get poor. Everyone want to be in a better position. I think we need to have to reach these people, to find the easy ways of reaching those people. So the learning to me is like this communication. We need to find an easy way to take the information to the people who need it most, who are in the far corner of the continent.
Yeah, I think it's a brilliant insight, Naz, and I completely agree. I do think that Africa has a lot to offer, and I also believe that the investments need to flow into Africa to give people the opportunity. Like you say, there is great opportunity there, and we can learn a lot from Africa. I totally believe in that. Amir, you've been sitting and listening. From your perspective, the leadership side of things, we do need to focus on leadership, and we do need to start raising the bar when it comes to leadership, supporting local leaders who are doing good things, not necessarily, the current leadership that we see at the moment. What we need is to find the people who are doing the right things and support them, so that they're elevated into the positions, so that they can actually get the message across, and that provides trust, And you're a pillar in Manchester, for example.
So thank you very much, Gareth. It's been really interesting listening to colleagues and their views. In terms of leadership, I'm not a politician, but if I take in terms of generally which countries have done the best, we've talked about Taiwan. No one's yet mentioned New Zealand, but we know that New Zealand's been one of the best performing. And in Europe, Germany's been sort of stood up as being lots of cases, but very few deaths. And if we look at the ones that have done badly, then the UK definitely isn't, is up there as one of the worst. So what's the difference between those that have done better and those that haven't? And there's still a lot of confusion out there in terms of why that's the case and why certain countries have done better and certain ones haven't. But one of the common features that I've seen is that those countries that chose to lock down earlier seemed to have protected their countries and their populations better than those that waited later. We can all look into why that's the case, but I guess the question then arises around what was it about that country that was able to provide a governance system that was able to then enable that lockdown to take place, and maybe there's some learning around that. In terms of moving forwards, because there's still a lot of confusion out there, and as countries are coming out of lockdown and we're moving into the second phase, which I think one of the speakers talked about earlier around, the deaths are not going to happen as a result of COVID-19, but they are going to happen as a result of patients with long-term conditions who haven't been managed. So those are patients with high blood pressure, diabetes, asthma, COPD, that are going to be, how are we going to manage them? Some of the challenges that we've got in the UK, well, around the world really, is that as winter approaches, we've got the flu season coming, and we know the value of vaccines and flu vaccines, but lots of questions being asked about how do we safely enable the high-risk population who up till now perhaps have been shielding to get those flu vaccinations without the transfer of the infection to those shielded patients. And then the other side of the coin is around how do we ensure that staff continue to feel safe. I read something in the last couple of days that said here in the UK, something like a third of key workers, so that's not just healthcare workers, but those running councils, those in other industries, up to about a third of staff are thinking about leaving that profession because they no longer feel safe. So there's a real issue around that, which then comes to the challenge around, we've talked about the public health crisis, we've talked about the social crisis, but we are seeing massive numbers of job losses now, which means there's an economic crisis that could be even worse than what the COVID-19 has caused. And then what I'm personally seeing as a GP is the personal crisis that individuals and families and communities are going through. We've seen, for instance, a 134% increase in deaths amongst patients with learning disability compared with the population. So if you've got a family, if you've got an individual who's had a learning disability, you'll have experienced that. Similarly, we've talked about, well, we haven't yet, but talked about the fact that if you are Black or from an ethnic minority and a key worker, a care worker, you are much more likely to have died or succumbed to COVID-19 than the general population. So there's big concerns about the protection of those staff members. Why has there been an increased risk, and how can we protect them moving forwards and maintain the service? So in terms of solutions, I think the very fact that we're doing this WHISTalk, where we've got experts from around the country, around the world rather, coming together and bringing different perspectives, there's no doubt that digital has enabled those that haven't. But I'm also very wary of what I've just heard about Africa. And it reminds me of, I don't know if you've watched the movie 1917, but of course that was about a message that needed to be sent from, only a couple of miles, but during a war. And how did they do it? And it was about a couple of people who were chosen, who went forwards with a piece of paper that had been given, a key message that had been given, and they had to cross enemy lines to get it across there. And there's something about learning from that message and thinking that's what they did in 1917. Okay, it was some sort of fictional movie, but there's something about, we've got a message on YouTube into a city. How do we get that into the community or into an urban, into the countryside or into a village that doesn't have the digital services? And it is about that talking, communicating with each other. And there's something about what I want to learn is how can we learn from around the world and find that common message that can get out to each and every person in the world.
I agree, Amir. I appreciate that insight. I was going to touch on this, later. When we talk about, that community engagement, there was a viral video that went streamed live here in Cumbria around social distancing, and there was a group outside a nightclub the other night, and they were all standing together. And I was looking at it, and I was saying to myself, that's a perfect opportunity for the NHS and public health to get down there and actually disseminate information so that you can actually get that awareness down there. But that's where public health is not in that space. That is the space we need to go into those groups and explain and get the information across. Manuela, from your perspective, and then I'll come to Paul, in terms of leadership, empathy, and health literacy, can you just give us a summary of what you feel will be the opportunity in the future? And then, Paul, it'd be great to get a summary from your perspective for the US side as well. And as a global leader, because the US is seen as a global leader, how can they, pick up the bat and start leading by example? Because we need a strong US. Manuela?
Sure. So thank you. Well, look, I will start by saying that societies built on libertarian principles tend to rely on individuals making the right choices on their own. And so they depend on the individual to adopt these proper behaviors based on reasoned choices. Yet today we see people all around in various countries, really all over the world, who are either over or underreacting. So we have the panic shopping buyers in grocery stores, or those that are not following any rules for safe practices. Those are just two examples of them. So simply knowing about the risk is insufficient, because when we have scientific knowledge on COVID-19, that's still limited. When interventions are complicated or inconsistent, and when fundamental values of self-interest versus communal solidarity continuously clash. So we have a huge abundance, really, of information, of health information from numerous more or less trustworthy sources. This is what's different with COVID-19. We live in an age where expectations about mastering health and specifically controlling risks of deadly infections really is higher than ever. It all comes, in my opinion, comes down really to transformational leadership, as I mentioned earlier on. So, and you mentioned, somebody mentioned about New Zealand, Amir, that's right. So, New Zealand is really an example of a transformational leader who has created a vision for the followers and guide through inspiration, motivation, but also through example. So let's have a look at our leaders and see whether they're actually up to the job or not. This can certainly help moving on to a new normal where information is real, where there is engagement and health literacy of our populations up to a great standard. And with that, we can move through this, I'm sure.
Absolutely. Thanks, Manuela. Paul, you've been waiting very patiently. Your perspective, you've heard a lot of, shall we say, well, we've had great experience from around the world. US, at the moment, it is a global leader. Same with the UK. I mean, it has gone, unfortunately, wrong. But the important thing is the lessons learned and how do we turn the situation around. That's really, we want to be solution focused, not a blame game. How do we do that? That's the question.
Well, we do that by having honest, resilient, and truthful leaders. And unfortunately, the U.S. is suffering in that regard. The larger question that I've heard today is, what are the critical factors that are required for meaningful learning, meaningful trust building? I think that applies to Mexico. It applies to Africa. It applies to us. We're still in the first wave, and it's clear that there'll be multiple waves. This virus will be with us for several years. And so the key questions are, how can we learn more effectively as an organization? The terrible tragedy of thousands of healthcare providers that have died and hundreds of thousands of being infected because of leadership failure around PPE, for example, is an example that will not be forgotten. Amir alluded to that. The same in the US. This has been a serious breach of trust between healthcare providers and governments and leaders. We're going to have to deal with that fallout for many years to come with a lot of mental health issues, suicide, depression, departure. But again, this comes back to what I call civic technology. While we need more technology, let's not forget the serious privacy breaches that are ongoing in some Asian countries. So this is a serious issue. While we need good technology for contact tracing, we need to have a balanced way of understanding what it means when governments can know everything about you. We know those problems from the past. We don't need to relearn those lessons. So there's a balance there of time-limited privacy challenges that we have to deal with. And so this is a challenge that the world has not experienced of the kind perhaps in 100 years. We're in it for a longer run, and we have to be ready to be prepared for that. People get tired, there's message fatigue and all the rest. It's clear to me that institutions like the WHO and others have been challenged on multiple accounts, as well as the CDC in the US, as well as the UK equivalent organization. And so the breach in trust in international organizations means that people are turning inwards to their communities. Now, that could be an incredible strength, including faith-based organizations, community-based partnerships. I think we need to focus much more on those aspects, and we in WISH have to talk more about these private-public partnerships, bottom-up collaborations, much more investment in social engagements, working with the best parts of the private sector, while government gives us guidance, but cannot be the only solution, because it's clear that in the countries that have done best, it's not because the government solved the problem, it's because the people solved the problem with wise governments, parenthetically, mostly led by women, so we should be thinking more about that, What are those characteristics that allowed those countries, not only because the women leaders, but these countries were wise enough to elect women leaders that represent a certain set of leadership values of resilience, of truth-telling, of empathy, and of engagement, which I think is clear going to be essential if we're going to avoid the partisanship, which my country has been locked in, many other countries have been struggling with. And without that, as Amir said, this becomes a serious social crisis, this nexus between public health, technology, and governance of democracies that are being undermined because of the lack of trust in foundational principles, which in the worst possible case could lead to civil unrest and civil wars. And there is those dangers out there. So we should be talking very honestly about that and those balance of tensions, particularly in countries that are newer to democratic values and newer to the need of free press. Press has been attacked around the world, notwithstanding some of the problems the press has had around reporting on COVID. Attacking the press is a clear undermining of democratic principles. So we need to be talking about how do we protect the press, even if they are mistakenly at times. We have to do that with democratic principles and not by throwing them in jail or harassing them or even killing them. These have been examples of that around the world. So I think these are some of the challenges that we at WISH will have to be focusing on how to bring back this trust to the organizational discussion and in a more meaningful and authentic way.
Yeah, absolutely, Paul. And I think what we're going to do is, you talked about fatigue, and I appreciate a lot of people are online and listening to this. So, and we're all fatigued. Manuela's stayed up late, and so is Dr. Haki. So we've all contributed magnificently to this discussion, and this will carry on, particularly WIS, you know, the platform is there. That's what we're about, is facilitating prevention, getting that public engagement going so that we can build that capacity within the community, building that trust. That's very much on our agenda. It's what we want to do. It's what we want to do with the agencies, the WHO and the other partners around the world to help and support that engagement. So I'd like to just say thank you very much to everyone, all our experts, for joining us from around the world.
Gareth, can I just... sorry.
Very
Gareth,
short.
can I just share a lovely little story? Yeah, really short,
sure,
but really helpful. So I just received a message from someone who's getting married in Canada. And obviously the challenge is, how do we get back towards normality but continue to maintain safety? Now, in the UK at the moment, they're saying that for a wedding, you can't have more than 30 people. And this particular family needed to invite 500 guests. So what they did was they had a little picture card thing produced outside a hotel at the front, if you can imagine, with the bride and bridegroom there and photographers. And they had like a whole group of cars with families in them. And each car would come to the front of the hotel. They'd get out, go and say their thank yous to the bride and groom, get a photograph taken, get back into the car, and then drive on. And then further down, there was food in an open place where they could collect food and they could safely eat and remain socially distanced. But it meant that all 500 guests or whatever it was able to join into the party, and it made it really special. Now, that's a really simple little example, and that was a video that had come through on a WhatsApp from somebody in Asia who'd found out about what was going on in Canada. And I thought, what a wonderful way of being able to be part of that special day and yet remain social distance. And I think there's something really, really clever about something simple like that. Just want to share that with you.
No, thanks for me. It's a great anecdote to leave on. I think it's a fantastic. Look, we all face challenges. Dr. Miranda is going back to work now.
Can I go, guys? Thank you very much.
We wish you the very best. I just want to thank everyone for their time this evening. And we're live next week. We will be online. We actually have our guests next week. Just going to bring up the poster for next week. We'll have Susie Ellis from the Global Wellness Institute and Nancy Davis. We'll also be speaking to Jean-Guy de Gabrac. So that's next Sunday at 7 p.m. for WHISTalks. We'll be talking about the wellness sector and the opportunities for them. So I do hope you can join us for that discussion. Thanks everyone this evening. I hope there's been some valuable lessons shared on the challenges and the opportunities that we face with COVID. I do believe that we have to get the engagement going within the communities. I think there's a strength there. I also believe the financial sector have a huge role to play in this, and we need to bring them into the conversation. And that's what we intend to do actually this week, is get those discussions around ESG. and we want to reach out to those investors in wider society who are interested in investing in social projects to get in touch with the WHIS, because we're the ones who want to drive that agenda forward. So thanks everyone for joining us this evening, and we look forward to welcoming you to WHISTalks next week. Thank you very much, everyone.
Thanks, everybody.
Bye.